Hello everyone, this is Misbah Harmain Sheikh. I will be explaining about medical deontology and medical ethics. So first things first, what is medical deontology? Medical deontology is a branch of ethics that focuses on the duties and obligations of healthcare professionals towards their patients, towards their colleagues, towards their batchmates and their seniors. So it is derived from a Greek word that is deon. And what does it mean? It means duty or an obligation a person should follow. So let's talk about the core concept of medical deontology. Medical deontology emphasizes on certain things or actions which have to be done regardless of their consequences. And it's often associated with the ethics, which argues the moral duties must be performed. Now let's talk about the main principles of medical deontology. There are a set of main principles, that is duty to care. Physicians must provide appropriate and timely care to the patients as it is their duty to do so, regardless of their personal feelings, their personal commitments, or their personal events. And they have to maintain confidentiality. So how to maintain confidentiality? Patients' information must be kept a secret until and unless it has to be revealed, and if it is revealed, it has to be by the patient's consent, or it is legally monitored. The third one goes on like truthfulness. Obviously, truthfulness is very much important in the healthcare industry. If we doesn't work on the truth, it's obviously a path to pay. Respect for autonomy. Even though deontology is duty-based, respecting a patient's choice consideration is ethical. Justice and fairness. So equal treatment to all the patients without discrimination, without being racist, or without seeing their status. It is a doctor's duty, or it is a healthcare professional's duty to provide equal treatment without racism, without considering about themselves. And then let's come on to the second topic which we are talking about, that is medical ethics. So what is a medical ethic? Medical ethic is a broader field that deals with the moral principles, governs medical practice, and it involves analyzing of moral dilemmas and decision making in clinical settings. So how could it go on? I will give you an example here. Debating whether to continue life-sustaining treatment or just stopping it. How could it go? For example, we have a patient in coma and we have no hopes that that patient could bounce back to life. So what we would do that? It depends. If a patient is young, yes, we could speak to the family and we could discuss among the board members, and yeah, we could try. If the patient is almost old or old, we would think this decision as twice. Why? Because almost there is no hope. Yes, it's a very tough decision, but we have to make it. So this comes under medical ethics. Let me give you another example. Considering how to allocate ICU beds. Yes, it's a very difficult thing because we have sentiments. We do have a lot of affectionate towards our people. Yeah, but we have to prioritize. And how to prioritize? If there is a situation where there is a newborn, where there is a middle-aged or an infant or a child, a toddler, or a old person, we have to choose wisely if there is a limitation of ICU beds. So we saw the cases when we had a pandemic of COVID-19. We became wise that time. Yes, all of the healthcare professionals and all of the healthcare industry was very much serious and worked together, and they worked together. And how would it be? Because it was a necessity. We had to save the upcoming generation, but unfortunately we couldn't let go our own people. We couldn't let go their sufferings, but it's a tough decision in medicine and we have to make it. And then what are the additional ethics and considerations? I'll tell you about that. Information about informed consent. Yes. So we have to ask a patient's consent in the cases like rectal fever, or in the cases like other assistance. If there is a male patient, we have a male doctor and a female doctor, we have to consider about the consent. Yes, it's very important. And then we have end to life decisions, as I mentioned earlier. And then we have resource allocation, research ethics. Research ethics goes on like clinical trainings, human subject protection. Professional integrity and accountability is also important. So this is the main thing which I am gonna say ahead. That is the 4 pillars of medical ethics. What are the 4 pillars of medical ethics? This is principle-based ethics. The first one goes like autonomy. What's autonomy? Respecting the patient's right to make their own decisions. Yes, our patient is free. It's not necessary that doctors should advise them. Yes, it's our duty to advise them, but it always, at the end of the line, it's a patient's choice and will, that will they have to or should they have to. Then we have beneficence, acting in the best interest of the patient. We have to always advise them and give them all the scenarios and aspects that happens, but we have to always tell them what are the risks, what are the pros and what are the cons, and best is upon them. Non-maleficence, do not harm. It means what? Do not harm. Avoiding actions that may harm the patient. It's just simple. And then we have justice. Fair and equitable distribution of healthcare resources for treatment without any discrimination on caste, religion, or any other aspects. So, what are the applications in medical practice? Let me go on this way. A real life scenario. Both medical deontology and medical ethics complement each other. And yeah, both medical deontology and medical ethics work together to create a better healthcare infrastructure. So let me give you a situation or a scenario. There is a terminally ill patient refuses further treatment. What is the deontological view on this? So deontology respects the patient's autonomy and duty to avoid harm through futile treatment. Yes, according to deontological view, it's a patient's choice that he or she requires a further treatment or no, even though they are severely ill. It's upon them, as we spoke about the beneficence and we spoke about the autonomy. But what is the ethical view on this statement? Let's talk. Balance autonomy with beneficence. Consider emotional, psychological, and social factors before deciding. So ethics, we all maintain ethics as human race. So according to the emotions we have, yes, we do have to look after the emotions, the behavior, and the family sentiments. So this would be the difference between medical deontology and ethics, and how deontology and ethics together work in healthcare.